Hello.
Hello.
How are you all?
I'm great. How are you all?
I'm good. Happy Thursday.
Happy Thursday. Hey, Lisa.
Hey, Lisa. I'm just pinning the comment in the section, but how's your day so far, Corey?
It's been good. I had to come back from Philly, had some things to do. I came back and got those things done, and now I'm to work.
Awesome. We love the grind. And how's the drive back?
I take the train.
Oh, nice. How's the train ride back?
It was pretty good. It wasn't bad at all. Honestly, I take it so much. It's kind of uh, like second nature type thing now.
Oh, that's good.
Yeah, it's like all the time.
All right. We've got the comment down there. If you could pin it at Whitman-Walker, that'd be great. But yeah, awesome. Well, welcome everyone. My name is Jewel, and I use she, her pronouns.
And I'm Corey. And I use he, him, his pronouns.
And Corey and I are here to introduce ourselves as part of the newest members to the Whitman-Walker social media outreach team. We're super excited to be here and just tell you a little bit about ourselves and who we are. But to start off, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STI testing and sexual health and best practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. So please never hesitate to reach out. We've actually pinned a phone number that you can use in the comments if you wanted to schedule an HIV or STI testing appointment, or if you just needed some additional resources around sexual health or health in general. I'll hand it over to Corey to intro himself.
Yeah. So again, my name is Corey. I've held many positions here in Washington D.C. As an outreach specialist as well as case manager, mostly case management with housing and non-medical case management. I recently held a position here at Whitman-Walker as a research specialist, but I am extremely excited to be back with the organization as a social media influencer. Um, a little bit about my background. So some fun facts about me. I'm actually the second oldest of five children. My mother gave birth to four boys and one girl. I am ethnically mixed, but culturally African American. I was raised in Virginia and New York City. I love to cook and be around positive vibes.
Nice. Sounds like we come from similarly big families. But again, my name is Jewel, and I use she, her pronouns. I previously worked in the External Affairs Department at Whitman-Walker in various roles over about 7 years, and I'm really happy to be back in this new role today as a social media outreach fellow with the Community Health Department. And then a little bit about me and my background. I grew up in Silver Spring here in the DMV area. I also grew up in New Jersey and am Liberian West African. I love cooking West African food, and I have a love relationship with hot and spicy pepper. So, like to the tune of ghost pepper, habanero peppers, and Carolina Reaper peppers. And I'm actually the second youngest of 9 children, six half brothers, and three full sisters. But my mom had 3 girls.
Amazing. Um, should we go into the to a little bit of our advocacy background?
Yeah.
Okay, so how I actually got started in this field, back in like the early 2000s, like 2009, 2010, I moved to Virginia. Um, Here I met like several like people that were in community that kind of influenced me for the better. You know, they kind of took me under their wing and just taught me the ropes, especially about HIV and STIs. I quickly like learned to. I quickly learned that these things were true because of around in this area, specifically they call it like the 757 area, in the early 2009 2010 era, like HIV and STIs were running rampant. Their numbers were very high in this particular area. Um, and I started to see that a lot of people that I was connected to, like family members or like friends, like chosen family, were being affected by this crisis. So um, I began to volunteer at this organization called Access AIDS Care down there around like the age of like 17. I was still in high school. Literally, I would get off the bus from school and I would go and get my mom, or I would take the city bus to Access that was like in a different part of the area just to volunteer when they had like events and things of that nature. Later on, I landed a position at a Hope for Tomorrow around 2017 as an outreach specialist, and I actually conducted and created a condom drop-off and testing sites in the parks in the area because of they were high traffic areas. A little in 2017, around June, I moved to Washington D.C., where I just continued in the passion, and I literally I found a passion for people that that are experiencing different life disparities and people that are underserved. So I continue the work, and that's how I got into what I'm doing now.
Awesome. Thank you for sharing that. Um, I think similarly, my first introduction to Whitman-Walker was through a volunteer capacity. I attended the University of Maryland, and in that space, we were invited to participate in the Walk in 5K to End HIV, formerly AIDS Walk Washington. So I joined their mailing list back then, and I think attended at least one walk back then. But fast forward to my senior year of college, I needed an internship to graduate and came across this opportunity at Whitman-Walker Health. And so I really loved the mission that they were about and the work that they were doing to support people who experience a lot of barriers to accessing care. And so I was super excited to be a part of that work and kind of get more experience and more exposure to sexual health and LGBTQ health because just growing up in my community, I didn't have a uh, I think accurate depiction or exposure to LGBTQ communities, and I wanted to kind of learn more about this community for myself. So I think way back then, 2015 or so, I had no idea what like the whole spectrum of sexual orientations was. I didn't know how you could be a more affirming healthcare provider by what questions you asked in healthcare spaces based on the types of sex that people were having. I didn't know much about HIV beyond a documentary that we'd watched in sixth grade health class called Oprah in Africa or Oprah and AIDS in Africa. And I'm super happy to say that, 6, 7 years later, I've done a 180-degree turn in terms of the knowledge that I am privy to know now. And I'm also a bit of a HIV and AIDS health historian here in DC, having gotten to work on Whitman Walker's documentary and just some different storytelling projects with DC TV, DC Humanities, and the Public Library.
Yeah, that's
Uh,
amazing.
thank you. So why Whitman Walker for you, Corey?
What I gained my passion for walking when I first moved here in 2017. I just wanted to simply work for the best organization that was in in the area. So that's how I ended up finding Whitman Walker. I actually started coming to Whitman Walker to their testing clinics. Whenever I needed to get tested. Back when I first moved here, and from there I was like, "Oh, this is like a really an amazing place. I aspire to work here one day." And so I just continued to push and get the experience, and then I ended up here.
Awesome. I think for me, it was my introduction was the internship, and again, they just had this really incredible mission, and I love that they were really helping people who wouldn't have had the same access to care otherwise. And so, in working there for as long as I was, I really do believe that they have a long passion for providing safer and more affirming healthcare to communities who are underserved. I think they do a lot of work to do right by their patients and to listen to patient feedback and help them and to let that patient feedback inform their strategic and future partnerships and strategies and kind of long-term planning for the organization. And they just hold a special place in my heart, being my first work home, and I've learned countless lessons there. So I'm just excited to be back here in this new role.
Yes, go Whitman Walker.
During this time, what do you, or during our time together as social media outreach fellows and influencers, what are you hoping to bring, and what do you bring to this role?
I honestly feel like I bring not only knowledge, but I bring empathy. I really just want to dive into topics that are that are going to start conversations that are going to truly make a difference. Sometimes we have to have conversations that are kind of going to make us uncomfortable to get to a better place. A lot of times people we'll sugarcoat things or take it to a level of where we're like, okay, well, I don't want to say certain things or bring up certain topics, but sometimes these topics are necessary for us to bring light to a situation that would otherwise be in the dark. So I really want to just go to some of these topics and situations that we really need to talk about to get to another place.
Mm. So important to have the uncomfortable conversations. Um, I think for me, in using this platform and being a part of this work, I'm really hoping to offer tools and language and resources and education to folks as it relates to women's health and how to have those conversations or those uncomfortable conversations with partners about getting tested and just how to create safer and more sensual and consentful environments when exploring dating and whatnot. I'm also hoping to just help people grow their self love and watch that kind of grow into an increase in community and relationship love. But that said, I'm also excited to practice my public speaking in this role and just look forward to being on this journey with you and the Whitman-Walker team.
Amazing.
Uh, that's kind of a little bit about me and Corey. Are there any final words you want to share, Corey, before we kind of go into the COVID vaccine prevention information?
No, not really. I'm a hands-on type of person, so I'm really just looking forward to what's to come. I'm excited about what's to come here, and that's really it.
Same here. Well, thank you all for tuning in. Before we go, we just want to give you a few reminders about the COVID-19 pandemic and vaccines because we are still living in pandemic times. If you have already gotten your vaccine, congratulations. You have taken a really big and important step to helping prevent yourself and your loved ones and your community from illness. Um, Multiple variants are always popping up and soaring across the United States and across the world. So we understand if you might want to keep on wearing your mask to help keep you safe because, vaccines aren't 100% effective at preventing COVID-19 and but they do help keep you healthier if you were to become positive with COVID-19 and to help you keep you out of the hospital and prevent you from dying. So that said, please continue to wear your mask. Thank you for getting vaccinated. Stay safe, stay alert. If you haven't been vaccinated and you are looking for an appointment, Whitman-Walker Health actually offers vaccine appointments. Everyone who's ages 12 and up is eligible to receive a COVID-19 vaccine. You can reach out to us at 202-207-2480. Again, that's 202-207-2480 if you want to make a COVID-19 vaccine appointment. And if you're having trouble making an appointment with us or want to go somewhere that's closer to you here in the DMV, DC residents can find more information about COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov. You can also call 1-855-363-0333. And you can track the speed and wait time for COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. For Maryland residents, you can learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, you can visit their vaccine registration portal online. And if you live in Montgomery County, you can visit their vaccination registration portal online, or you can give them a call at 202-777-0311. And finally, for Virginia residents, if you want to learn more about the vaccine process or access an appointment, just visit vaccinate.virginia.gov or call them at 1-877-829-4682. And finally, if you haven't been vaccinated and you are not looking or interested to get vaccinated, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's really important that you do consider getting the vaccine and discuss discuss COVID precautionary measures with those around you, but be mindful of mask and keeping your distance, especially if you do not know if the person you're with is vaccinated or not. We thank you all for joining this live with us, and we want you to please follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website, www.whitman-walker.org, for the most up-to-date information on our services and COVID-19 vaccine operations. And just for more general resources and whatnot, you can call us at 202-797-4439. That number is pinned in the comments where you can schedule an HIV or STI testing appointment. And please also follow our Whitman-Walker family on Instagram at realtalkdc_ or nofilterdc. But yeah, thank you all for tuning in. And Corey and I will be back weekly with Instagram Lives.
Yep. Have a great day, everybody.
Happy Friday Eve.